My name is my name is Dr. Sue, and I'm one of the doctors in this department. May I confirm your name and your age, please?
Yes, doctor. I'm Anastasia and I am 16.
Okay, nice to meet you, Anastasia. I understand you were seen by the medical department after something happened. Maybe, sorry. Okay, can you tell me what happened this morning, Anastasia?
Can I go home?
Okay, I can see that you are really eager to go home, Anastasia. And I just need to ask you a few questions maybe, and then we can see how best we can help you before you go home. I can also see that you sound quite sad, Anastasia. Is there anything that I can help you with?
I'm okay, doctor. I just want to go home.
Okay. No, I'll let you go home as soon as that is feasible. So I just wanted to find out what happened this morning, Anastasia.
I just cut my wrist.
I'm so sorry to hear that. How are you feeling now?
I'm okay. I just want to go now.
Okay, I can really see that you want to go home. We just want to try to help you before you go home. So can you tell me more about why maybe you cut your wrist this morning? I can see that this is quite difficult for you. I promise everything that we'll talk about, Anastasia, is between me and you, and we'll do our best to help you. Is that all right?
Yes, doctor, actually,
Mm-hmm.
I missed my periods and then I found out that I'm pregnant. I told my
Okay.
boyfriend about it and then he broke up.
Oh, all right. I understand. I can see why this is quite a distressing situation for you. Let's see how we can help you, Anastasia. I also understand you took some tablets. Can you tell me more about the tablets?
Yeah, doctor.
What were the yes? What were the exact tablets?
I took some contraceptive pills.
Okay, okay. How many?
20.
Okay, all right. So is this something that you've planned for some time?
No, doctor.
Okay. So it happened just after you got the news about your missing your period. Okay, I can see that. So how did you get here?
I called the ambulance.
Okay, you called the ambulance. Mm-hmm. All right. No, that's good. It's good that you called the ambulance. So can you just tell me about who you stay with, Anastasia?
With my mom.
With your mom. Did you talk to your mom about any of this?
No, doctor. How can I? She will be so
Mm-hmm.
upset.
Okay. Yeah, I can see that this is something that would be difficult to share. And do you have any friends?
Yeah, I have few friends.
Okay. All right. And how has been your mood lately?
My mood is okay.
Your mood is okay. Okay. Do you by any chance take any alcohol?
No,
Okay, good. Any recreational drugs?
no, doctor.
Okay. Maybe just a few questions about your partner. How old is your partner?
16.
16. Okay. And have you been on any contraception before?
No, doctor.
Okay. So how is the relationship now with your partner?
We broke up yesterday.
Oh, yes, you did mention. I'm very sorry to hear that. So just a brief about your general health. How have you been? Do you have any medical conditions?
No, doctor.
Okay, good. Are you on any medication?
No. Can I go home now?
Okay. No, I can see that you're quite eager to go home. And from the information that you've shared with me, maybe first, can I examine you just to check your vitals and just see if everything is fine? Maybe just check your tummy.
Okay.
Okay. And then, okay. So from the information that you've told me and from the assessment that I've done, I think that you
Minutes?
did make as hello.
Yes, 6 minutes. Yes, continue.
Okay, so I get you I can tell that you are feeling quite down because of what happened with your boyfriend and that you suspect that you are pregnant. So I would like to do a pregnancy test on you, if that's okay, first, just to check. And before maybe I send you home, I would like you to go for counseling, just some talk therapy, so that we can see how you can be assisted maybe to share this news with your parents. Is that okay?
Can I go home now? Doctor, I can come later for talking therapy.
Okay, I can see you're really eager to go home, but we wouldn't recommend that you go home at this moment because I think that you still need a bit of support and maybe just assessment from one of my seniors to come and talk to you and see, because I can tell that you did you did attempt to take your life, though now I can tell that you feel better. Would it be okay if somebody else can come and talk to you first before you go home?
Yes, doctor.
Okay, that's good. And I would encourage you, I think as much as it might be difficult, this is something that I would encourage you to share with your parents. They might be
No,
able to
please
assist
don't tell my
you.
mom. Are you going to tell my mom?
No, we will not share with your mom. I'm just encouraging you. If you can share this with your mom, and then depending on the pregnancy test results, I'll refer you to your GP who will advise you on further care if the results are positive.
Okay,
Any
doctor.
questions so far?
No.
No questions. Okay, let's see
Time's up.
if we can.
Okay,
Hello?
good. Yes, good, Dr. Sue.
Yes.
Time's up. All
Okay.
right. Okay, so what do you think?
Okay, so in the beginning, I think I was a bit nervous and I freezed a bit. So I didn't ask my questions in the order maybe that I had in my head.
Mm-hmm.
Yes, so I probably was supposed to ask more about maybe the cut wrist, but I didn't go into much detail because I thought, okay, we are now in psychiatry. We are no longer in the medical
Yeah.
team. Maybe you clarify that for me, which part of the history I'm supposed to go to and which part of the history I'm not supposed to go to.
Mm-hmm.
But yeah, I think there was a bit of disorder in my history taking. And
Mm-hmm.
then management, I wasn't quite clear, but I managed to at least speak to her and get to her to agree, which I thought maybe that was a good thing to stay for
Yes.
further assessment. Yeah.
Yes, that's true. And before I go on and give my feedback, anyone else want to add anything here?
I think for her to decide if she needs to admit or send the patient home, she needs to assess the risk of further suicide
Yes.
by asking about her insights if she thinks she needs help
Yes.
with regards to what has happened so far. and also if she feels any regrets to what she has done so far.
Yes, perfect. Good point. Anyone else with anything? All right. So yes, you are right, Dr. Sue. So in the beginning, you were struggling to open the station. I know it because you can't see me, you can't see my expression, and it's difficult. But in the real patient, in the real life, I think your IPS is good. So you will be having something to say at that point. You will not be struggling with the start. But even if you don't know anything, Dr. Sue, you can just ask, how are you doing today? And patient looks down. Patient, this will be a difficult patient. He will be difficult to open. She will not look at you. She will not make eye contact. She is definitely looking unhappy. So one way or another way, you can use your task for the patient like you did. But before that, you can just, start your session in an open way. What was the name? Anastasia. How are you feeling today? Are you okay? And then use your task and mention about confidentiality and everything. So you were struggling in the beginning, but later on you came to the point. You used the task and then you were able to open her. But in the exam as well, she will be difficult to open. So just don't lose your words there. Keep saying something, keep encouraging her, and mention about confidentiality as well. But when you are mentioning about confidentiality, please bear that in your mind that it is not between you and patient, it is also between the team, right?
Yes.
So whatever you will
Yes,
say
you're
will
right.
be between you and my team. You can say like this. Because you are the junior most doctor, although you are seeing this patient, but you cannot discharge this patient or make a important, decision about the patient without your senior help. So it makes sense if you are saying my team, because you will be sharing this with someone, sorry.
Okay.
And then you were having some questions about what are the things we should be asking and what things we should not be asking. So regarding this cut wrist, why she did that, you had the answer for that. And when she did that in the morning, and how deep was it, and if there was anyone at that point or not, why you are asking these questions? Because sometimes when somebody is attempting suicide, sometimes they are doing just this for attention, and they just don't want to kill themselves, right?
Yes. Yeah.
So if it is not very deep, and if there were other people around as well, so it means that they didn't want to take their life. They just want some kind of attention. Although it is a very, very sensitive topic, and you should never let somebody go home who had suicide without fixing their mental health problem. Apart from that, another thing, if you are seeing somebody and he mentions about something about suicidal ideation, or he want to kill himself, you can't let that patient go home, even if he hasn't done anything.
Okay.
Because if he or she does something in the future, the blame will fall on you, because he mentioned it to you, and then you will be in trouble, right?
Yeah.
So how deep, and who was there, and what did she do after that? These questions are important because you are checking her insight as well. So if it was not very deep and she was sensible enough to call the ambulance after that, and then she came to the hospital after that, it means that she is having some insight that it was not a good thing she did. And also she doesn't want to kill herself, because later on she just panicked, she did it, and then later on she called the ambulance by herself and came to the hospital. So that is a very good thing. Because when now she is in hospital, and then we can get into detail for everything. But because it is very important to ask about any future suicide attempt ideation as well. So you didn't ask about this part. This is important, because if she is feeling like attempting another suicide attempt, having another suicide attempt in next few days or in next few hours, you can't let her go home at any cost. So how you feel about it? At some point, when you are having some rapport with her, after that you can ask her, how do you feel about it? So although she called the ambulance, that cut was not very deep, she came to the hospital. So it is a way of telling you that maybe she is not happy about it, but
Yes.
but still it's best to ask. So it's clear
Okay.
that it's clear, right, that she didn't want to end her life because she called the ambulance by herself.
Yes.
Yeah. And then ask her if she's planning to do this again. I'm really sorry to ask you this, but what are your thoughts about doing this again? How do you feel about it? And then you asked me about planned or not. So then mood. You asked me about mood, but it's always better to score the mood. Even if she's saying my mood is okay, but always ask your patient to score the mood on a scale of 1 to 10. Okay?
Yes, thank you.
And then comes this part. In psychiatric station, this whole thing is very, very important. Even if it is this station, depression station, psychosis station. So this social bubble should be very important for your patient. You ask me about whom do I live with, and you can ask me another question as well. How is my relationship with my mom? Yeah.
Yes.
Although you ask me, have I mentioned this to my mom or not? But you ask about relation as well. Then there are any friends or not. And then alcohol, recreational drug. When you are asking about recreational drug, deal it with in a sensitive way. Signpost, or you can, I'm sorry to ask you, but by any chance, any recreational drug.
Okay.
And then you asked me about partner age was okay, their relationship was okay. It's just like they had this she was pregnant and then they had a breakup. So apart from that, it was okay. But if there is a discrepancy in age, then that is also a red flag in psychiatry at a age of 16 years.
Okay.
So your management was good. Although in the beginning it was not very clear if you are sending me home or not, but then I asked you, can I go home now? So then you said, I will involve my senior. You will be seen by some other doctors. They will have a chat with you. And then we can decide if we can send you home or not. You covered this bit as well about pregnancy test and then gynae or GP referral, and then they can discuss about different options. Very good. Encourage her to involve the family. You did that as well. Very good. So, Dr. Sue, most asking again and again, can I go home? Can I go home? So if somebody is asking a question and again and again, so don't you think it will be better to ask me if I have anything particular in my mind that I'm asking?
Yes. That's true. That's very true.
Because it's a verbal cue. Although you didn't ask me, so I didn't mention anything. But if you ask me, I might be having a hidden agenda in my mind. Right?
Okay.
Maybe
Yes,
my
that's
mom is
true.
not aware that I am in hospital and I am concerned. Maybe that I want you to tell my mom that I am here, or I can call my mom.
Okay.
It can be anything.
That's true.
There are other patients, like for example, in domestic violence station, they will keep saying one thing again and again. I want to go home. I want to go home. And it is because of some reason. For example, a lady who had domestic violence and she's asking you again and again. She wants to go home because the kid is at home, right?
Yes. Okay.
So if somebody is asking you something unusual or something that is that they are repeating again and again, so it's better to ask why you are saying this again and again. Any particular reason you want to go home? And thank you so much, all of you guys, and you did it really well, Dr. Sue. I think your IPS is good, and because you did this station is a difficult station, and everybody will be struggling with this station, so don't worry about it. But since you have done it once, you will be much better. If you get this station in your exam, you will be better. You will be performing it in a more better way. This station.
Thank you very much.
And there is another station as well, right? The one in which you have to do sampling. Do you know about that as well?
Do what? Sorry. Oh,
there is a combined
the one where...
There is a combined station where you have to do blood sampling, I think, or cannula, and she is also coming with this cut wrist or maybe pills. So she is also very difficult to open. But in that combined station, you have to do cannula or sampling as well.
Okay.
So both of these stations are difficult because she is really difficult to open. She won't tell you anything. It's just your IPS skills that will, help you in those kind of stations. Make sure you are being a good doctor for them. You are offering them empathy. You are being sensitive to their feeling, and then hope you will be fine in the station. And also you are being safe doctor.
I have a question. Can I find out